forcing them into the expensive ER, and that's not what we're wanting to do. So hopefully this new system will help with that and make things a little bit easier. And it's actually a big issue here in the Salem urgent care facility right here. Hopefully some of our participants may speak to that today if we don't have a question on that. The other thing is it's supposed to, the Admission Act is supposed to increase and modernize our IT system with the VA. You know, VA was one of the first governmental agencies to actually go to electronic health records to, again, make sure that there was less human error in transposing records, and your record could follow you wherever you went in this country. Private sector has started to catch up, frankly, maybe getting beyond us, and I think the VA is very, very aware they need to modernize their original electronic system, and this hopefully will provide some of the assets and some of the opportunity to actually do so. And back to the recruitment piece, this is a big deal. As I said, there are huge implications right here in Salem. We're trying to incentivize these folks. We've had scholarships, but we're expanding them. Actually, and the debt reduction program, we're expanding that. Used to be like for the debt reduction program, there was a limit of $25,000. It's going to increase to $40,000 for a total of $200,000 over the life of the program, which is a big. It was $125,000 before. So this way, these docs and health nurse practitioners that come out of school with these huge debt burdens, because it's not getting any cheaper out there, can actually say, wow, okay, I could earn maybe a little more money in private practice, but they're not going to pay off my debt like the VA is. I'm going to actually serve the men and women. So that's, Mr. Goodspeed and the VA are really trying to respond to some of the concerns we've seen right here in Salem. There's also the Vet Center program, also the mental health aspect. It's a tough world out there, no matter whether you're a warrior or a civilian, and the goal here is to kind of get a little more seamless delivery of the healthcare system. In Oregon, as you know, we practice a more holistic healthcare. It's not just about treating you walking in the door for whatever physical ailment you have, but they talk to you about your nutrition, your mental health, vaccination, the whole 9 yards to make sure you're getting quality care when you walk in the door. The VA is following suit, I think, in that regard. So I think we're in a good spot, frankly, at this point in time, or a better spot than we were certainly a little while ago. And hopefully at this point, you can continue to improve the system, and that's why we're doing these forums around the country right now. Mr. Goodspeed will be the first up to chat with us a little bit. He was former director out in Sioux Falls, VA, out in the Midwest for a bunch of years. He worked in, frankly, different healthcare settings, both with veterans, Department of Defense, and private sector for over 25 years. Most importantly, to be frank with you, from my standpoint, for his credibility in dealing with the VA, he served in the United States Navy active duty 25 years. So he walked in your shoes at least a little bit and maybe understands like some folks don't exactly understand. So I really appreciate him being here. And with that, if you wouldn't mind saying a few words, sir, I'd appreciate you and your team.
Thank you very much. I came to the VA because I wanted to help my fellow veterans, and nothing gives me more pleasure than helping my fellow veterans get the healthcare benefit that they've earned. The Mission Act changes almost everything about how we provide care in the community, how we coordinate that care, how we pay for it, and we've added new benefits. The urgent care benefit is a tremendous resource for folks. I'm not going to take a lot of your time. The two ladies at the end of the table are subject matter experts. They helped us implement this program in our area. They will be able to answer any questions you have about how the Mission Act is going to change how you access care in the community. Nobody here has access to your medical records, so if you have a question specific to what about my appointment, or when is my prescription going to arrive, if you could just save those to the end and talk to one of us from the VA, we'll take a note and we'll have someone get back with you tomorrow. But today, no one has a way to answer those personal questions. But at the program level, we should be able to answer all the questions you have. Thank you for being here tonight. It's great to see such a good turnout, and hopefully we can provide you with a lot of good information on the Mission Act.
All right, good evening. I'm Tiffany Anderson, and I'm the Acting Director of Community Care in Portland at the VA there. So you've gotten a pretty good base of what the Mission Act is overall. And Rachel and I are here, we want to be able to give you some more details that are included in the program. First of all, I want to stress that what we really want to do at the VA is to help you as the veteran and the family members to make an informed decision as to whether or not you choose care in the community or at the VA. So it's very important that when you talk to staff at the VA that we're as transparent as we can be and explain the full, the process that you will go through if you choose care in the community versus at the VA. Because as some of you who have been in the choice program know that it got a little chaotic and it was messy, and sometimes it took longer to get your care in the community than it did at the VA. So this is a huge change, and I'm very excited about it because we can at least sit down and have a good conversation with each of you when you're with the scheduler or whoever, the provider, and they can help you understand what it means to choose care in the community versus the VA. And as Mr. Goodspeed alluded to, this Mission Act is a lot cleaner than the choice program. It's more streamlined. There aren't as many different branches to the full tree, so to speak. And there are some good improvements to it. And I'm going to have Rachel go through the specific eligibility criteria that is included in the Mission Act, and then I'll talk about the urgent care benefit.
Hi there. Okay, so for those of you who are familiar with the choice program, as I'm sure you all are, you're familiar with the eligibility criteria, right? If we couldn't get you in for an appointment within 30 days, then you are eligible for community care. So they have changed those standards now. So if we cannot get you into an appointment at the VA for mental health or primary care within 20 days, you are eligible for care in the community. And as Tiffany mentioned, that doesn't necessarily mean that we can get you a provider in the community within that time frame, but you are instantly eligible for community care based on that. Now, if you need specialty care, say orthopedics or a cardiology appointment, if we cannot get you in Portland within 28 days, then you are also eligible for community care. Now, one thing that they have also implemented with the Mission Act is the drive time standard. So this has been really, really a wonderful addition because we have a lot of veterans that travel distances to get to the Portland VA. So this is something that's brand new. It's a drive time standard. So for primary care and mental health, we have a standardized tool called the Decision Support Tool. And it's an automated tool that will put in the address of where the veteran lives and where the services are available at the VA. If that is outside a 30-minute drive time for primary care or mental health, then you are eligible for care in the community. And if it's greater than 60 minutes for specialty care, you're eligible for care in the community. So those are our access standards. The next one I want to talk about is the same as it was in the choice program. So if you need a service that the VA doesn't provide, mammography is a great example. You need a mammogram, we don't provide that service, you are eligible for care in the community. The next one is best medical interest. And what I really, really like, and I would say our nurses in community care really like about this one, is the continuity of care benefit that we have not had in the past. So with the choice program, it was a little bit more rigid. Many of you are probably familiar with Salem Hospital. So say you have a bad fall, you break your leg, you go to the Salem Hospital for orthopedic care. So in the past, if we had access at the Portland VA, then we had to bring you back to the Portland VA for follow-up care. Now, that was not appealing to our veterans who were breaking up their care. Our providers weren't comfortable taking over another provider's care. And our providers in the community, frankly, didn't like it as well either because they wanted to treat you if they saw you in the ER, right? So now there's a continuity of care piece to this best medical interest. So if you go see your provider, you call your provider, say, hey, I went to the ER, I had this happen over the weekend, can I go back to that surgeon or that doctor that treated me? That provider, your primary care provider, can put in a request to community care under best medical interest for your continuity of care. So that's a wonderful addition that I wanted to highlight because it's been a big frustration for some of our veterans in the past. So another one is grandfathered eligibility. So for our veterans who are 40 miles under the choice program, there's a grandfathered eligibility. So you will be eligible for community care services through June of 2020. And that was because we didn't want to have any abrupt stop or disjointed care come June. So that's kind of a grandfather program to make sure that there's time to transition all the care to the appropriate entity. The other two, one is still in the works, it's quality care. So if the VA cannot provide quality services for you for a particular need that you may have, then you're eligible for care in the community. Those quality standards are still being worked on, so we're awaiting further guidance, but that's something that's coming. And then if there's no full service VA in your state, that doesn't apply here, but like Alaska, they don't have a full service VA in the state of Alaska, so those veterans are all eligible for care in the community. So as you can see from the choice program, it's really expanded the amount of eligible veterans.
Right, and I just wanted to add on the drive time. I just want to make sure that you're aware, the way they calculate the drive time in the DST, which is the decision support tool, is they take a rolling average over the previous 30 days to calculate how, if you meet the drive time standard or not. So this means that 1 month you may be qualified if you live right on the boundary of the 30-minute or 60-minute drive. It could mean that you meet the drive time for this month, but the next month you may not, because whatever construction process was going on the freeway, it improved traffic. So that's one big change. I know it's confusing, and if you have questions, we will definitely answer, but that's something I really want to make sure everybody's aware of, and I don't want you to be blindsided with it. So please, if you have questions, write them on the index card, and we will be more than happy to walk through it, okay? The next thing I want to talk about is the urgent care benefit. And so this is something that we're all very excited about. And so if you need to be seen by an urgent care provider, the way you qualify is if you've received services through the VA in the last 24 months, okay? And so if you meet that qualification, you can seek care at any urgent care facility that is in network with our third-party administrator, which happens to be Tri-West. So it's very important that you go to an urgent care facility that's in our network. If that urgent care facility writes for a prescription, you can now go to a pharmacy that is in network with Tri-West. And we did, and I know Pat can expand on this, but we did sign up with Express Scripts, so we have about 115 pharmacies in our network, which is great news. So you can walk into one of those pharmacies and get your prescription filled for a 14-day supply. So that is wonderful. Urgent care, I know there are some challenges out there. It has not, the beginning has not gone smooth, but is what we really need to hear about is when you go to an urgent care facility and they're not aware of the Mission Act or that they're treating veterans, that you let someone at the VA know so that they can get word to Rachel and myself. Because then we're working closely with Tri-West. We're also calling these centers and making sure they understand what the Mission Act, and including pharmacies. So if you have any issues with like that personally, please see Rachel or myself afterwards so that we can troubleshoot with our partners at Tri-West. Okay.
Oh, yeah. They're around for lots of questions. Last but not least, Mr. Shea, who's the Tri-West primary representative for VA management staff here in our region. He's trying to develop these collaborative relationships so things go a little more seamlessly maybe than they have in the past. He looks at the local market dynamics, suggesting some of the new opportunities that might arise that we've been talking about here so far. So happy to do it.
Thanks, sir. Good afternoon. Again, I am Pat Shipley. I'm the liaison between Tri-West and several of the VA medical centers in the western part of the United States. I am a veteran myself, an Army Medical Service Corps officer for 21 years and change. I share this responsibility with Mr. Joe Nortz, who's also a Navy veteran, a retiree. And so all of us at Tri-West are very interested in making sure that the program works for everybody, despite some of the challenges and that type of thing. But I wanted to go ahead and to basically just sort of lay out a little bit of the background in terms of who Tri-West is, why we're here, what our responsibilities are with respect to support of the VA and the Mission Act. And then I have a couple of individual specific items that I wanted to go ahead and to basically just make you all aware of. Tri-West has been in existence since 1996. We were originally designed to go ahead and to manage the TRICARE program for the Department of Defense. We did that for about 16 years. When that contract ended, we reorganized and responded to a solicitation from the VA to manage the patient-centered community care, the PC3 program, which was the first iteration, if you will, of the VA's attempt to go ahead and to sort of standardize the care in the community process. After we started that program in January of 2014, it was in April of 2014 when the long lines at the Phoenix VA and that type of thing prompted the choice program. Choice program was signed in August of 2014, and the VA asked us to go ahead and to take on management of that program as well. And we did that starting in November of 2014 and have been doing it since then. We worked through the choice program, and now we're going into the Mission Act and supporting the VA in this regard as well. During the time that the Mission Act is in place, Tri-West will be the manager, if you will, of the program until such time as the Community Care Network contracts are awarded. Community Care Network is the next evolution of the program, and we're waiting for a decision on that contract for this particular part of the country that's due sometime in the near future. But during that time, and until such time as the new contractor, whether it's Tri-West or some other entity, wins that contract and starts the CCN program, Tri-West will be managing the community care in the network portion of the community care. Our network at this point in time, and we are responsible for the entire United States. So we have over 1 million locations. We have over 900,000 providers currently in the network. It's one of the largest managed care networks in the country. We think we've done a pretty good job in terms of pulling together quality individuals into the network, but we're constantly monitoring that to make sure that the quality remains as high as possible. With the onset of the Mission Act, Tri-West will continue to go ahead and to manage the care in the community. They'll be using our network until such time as the CCN program kicks in. And we are also responsible for setting up and managing the urgent care network. The urgent care network has been a bit of a challenge. It's not just a matter of walking into an urgent care center and asking them if they're interested in serving the veterans, because most of them are. But there are some requirements in the contract to make sure that the services that are provided are of a certain quality, and meet some of the requirements that are in the contract. For example, an urgent care center must be a Medicare participating provider. They also must be able to bill a certain way. If they don't meet those criteria, then they're ineligible for being into the network. And so it's just Tri-West's responsibility to make sure that all of those requirements are met before they can come in. And just to give you an example of some of the challenges that we've had, I'll point out the area of the San Luis Valley in Colorado. In the San Luis Valley in Colorado, there are 3 large healthcare providers, all of whom offer urgent care type services. But they're not Medicare participating, or they don't bill according to the requirements of the contract. And so consequently, we have, at the present time, we have a situation in the San Luis Valley in Colorado where the urgent care benefit is not available, even though there are providers in the community that are interested in doing it. So this is an issue that we're working through. We've identified this issue and pushed it up to VA leadership, and they're in the process of going ahead and basically modifying the contract so that we can go ahead and incorporate some of these people. But when you look at the timing of bringing the urgent care centers into the network, these are some of the issues that we're having to work through, and which are impacting, whether you have 1 or 2 or 10 or whatever urgent care centers in your area at any one particular time. There's just a couple of administrative process issues that I'd like to go ahead and to talk about. If in fact you've been referred out into urgent care, or excuse me, for community care, and you have a Tri-West authorization, if you get a bill, it's a mistake. Don't hang on to the bill. Go ahead and make sure that you come back into Tri-West, let us know about them. We have a department that's responsible for fixing those within about 48 to 72 hours, as long as we know that that's been out there. Don't pay the bill either. And then you say, well, okay, so now it's going to impact my credit. Well, as long as you get us the information quickly, we can go ahead, we can get it adjusted, and it will not affect your credit, and you should not be paying that bill. What we find is that in 9 out of 10 cases, billing problems have nothing to do with you. They have everything to do with the provider. The provider is not billing correctly for whatever reason. Sometimes it's just a mistake. Sometimes they haven't read the instructions, whatever. We can usually fix that pretty quickly. And because of the fact that Tri-West used to manage the Tri-Care program, we get a lot of confusion between Tri-Care and Tri-West, and that also impacts the billing. The other thing that I wanted to mention just briefly, and then we'll take questions, is the telephone number for access to information about the Mission Act and that type of thing will be changing. You're probably used to using the 866-606-8198 number. Sometime in September, probably that telephone number will be turned off because the choice program doesn't exist anymore, and we'll be using the PC3 number, which is 855-722-2838. Please put that number in your cell phone. You put a contact in there. Oftentimes, the telephone number will be 855-722-2838. We definitely want to go ahead and have you make a contact in your cell phone or whatever with that particular number. One of the reasons that we end up having to return referrals often is because we can't get a hold of the veteran. We find that because it's an 855 number that comes up on the caller ID, because of the way the telephone system is set up, when I have an 866 number at my house, I don't answer the phone. I'm sure you don't either, but if you know that you're being referred out and you see an 855 number, please answer the phone because we're trying to get a hold of you, and that type of thing. Number one more time, 855-722-2838. Okay, and I think we'll take questions.
So we have microphones here, so we don't have to stand up. You guys